I want to thank obviously our panel for being here. You guys are an amazing panel. I was looking at your biographies, and it's truly impressive, and it definitely makes us all very proud to have you guys here. So why don't we start with a little brief introduction of what you guys are, what you guys are doing, and so I'm looking at my screen here, and I looks like Becker is the first one on my left. So, Stephanie, why don't you introduce yourself and tell the audience where we're at.
Okay. Hi, my name is Stephanie. I'm a third year graduate student at UMass Medical. Now it's UMass Chan Medical School. And yeah, so I graduated in 2015. And then I went to Cornell University in upstate New York for my bachelor's. And now I'm at UMass Chan. And I'm a third year. I'm studying neuroinflammation. And I did some work on SARS-CoV-2 during the pandemic. So I'm happy to talk about that and share anything else.
Beautiful. Dr. Mishra, Supriya. Got you by surprise there.
Hey, I'm Supriya. I graduated in 2007, so I'm probably the oldest one here. And I am an OBGYN. I'm an OBGYN doctor who delivers babies and also takes care of women. I went to college at Stony Brook in Long Island. I also went to medical school there. And then I did my residency also in upstate New York, like you for Cornell. I went to upstate in Syracuse. And now I'm in DC at a private practice 30 minutes north of DC.
Beautiful. Thank you. Jackie?
Hi, everyone. I'm Jackie. I graduated in 2019. I'm currently studying nursing at Drexel University. I'm a third year, so I graduate next year. And I recently just finished my cooperative program at the Hospital of UPenn. So I had a lot of exposure to COVID patients on the heart and vascular ICU. So I'd love to tell you about that too.
Okay, great. Julia?
Hi, everyone. I'm Julia. I am also class of 2019, so also a third year in college. I go to the University of California, Berkeley, and I am a dual degree program student in public health and molecular environmental biology. So a lot of my research has looked at the overlaps between environment and the impact on human health. And I am studying to be a doctor, so I'm hoping to go to medical school the next few years after graduation and ultimately an OBGYN, so super cool to learn from Supriya as well. And I worked at NYU this summer in the CCU as well as the neuro unit in Brooklyn. So I had exposure to COVID there, and I work at a vaccine clinic and a COVID testing center at Berkeley. So I've had some experience in that as well. So happy to answer anything.
Okay, so that's awesome. That's great. So thank you all. So clearly you can see that, we have a panel that really fits the theme of this talk, which are vaccines and viruses. So I'm going to throw something out there, and then you guys can, pick it up, whoever wants to go first, and then you can add and delete whatever it is that you want to comment on. And then we just kind of progress, okay? So we'll start with something, I guess, a little in sort of more of a general outlook, and that would be that we have here is, if anything, what has surprised you about the COVID-19 pandemic? That was one question that we had. You guys can jump right in. Whatever
I would say that I'm really shocked at how afraid people are of coming to doctors now in general. There's unfortunately a lot of misinformation on social media. Everybody has a smartphone nowadays, and they're constantly on TikTok, Instagram, whatever have you. And, social media plays a big role on how people think about things. Nowadays, things are very Googleable, and I feel that as a physician, sometimes just 15 minutes at an annual visit is not enough to take that fear away from people and re-educate and reorganize the thought process and have that trust back. So I think that was something that I have learned more about since I've been practicing since COVID struck.
Yeah. So somebody, anybody else, you can piggyback on what Supriya had to say, or you can go back to the original question, and then again, let's see if we can engage. So, anybody else want to follow along?
Just piggybacking off of Priya, there definitely is a lot of misinformation about the vaccine and COVID in general. A lot of our patients that were coming in with COVID were unvaccinated. So it got to the point of them like being intubated or being on a ventilator, and it was really serious. So it wasn't until that point, or like when they were able to finally come off that intubation, that they were like, oh my goodness, can I get the vaccine now? Now it seems like it'll work. So there's definitely a point of misinformation and miscommunication that we have to address so that people can understand like the severity of it and how actually being vaccinated is beneficial.
I think for me, I was shocked just how much of like laboratories shut down and institutions and universities shut down. So people had their mice like aging for years and it just completely shut down one day and people's whole experiments and projects were kind of lost. So that's something that shocked me for my work specifically.
If I can just jump in here before Julia gets a chance. So, Stephanie, so you are actively doing research now, right? Right. So and Supriya talked about perhaps fear, and Jackie talked about false information. From the perspective of a scientist, how do you manage? How do you deal with some of the misinformation that happens to be false, and yet there's such a large number of people that are incorporating that information and having the wrong perspective of what is actually truly happening?
Right. Yeah, this came up a lot and just continues to come up a lot, even with my family and just, having dinner discussions. And recently I had my partner at the table and my uncle was there and he really only got his vaccine because of work purposes. And so we engaged in this whole conversation about, FDA testing and vaccinations for younger people, for children. And it was pretty interesting to be totally engaged in that. And I think we got to a point where we were able to engage in a conversation, but I know that that's pretty hard for sometimes for different people. And so I've tried my best with my family to engage, and I think they've been responsive, so that's really good. But when it comes to other people who might have misinformation who are not ready to engage, I think that's really hard. And I don't know if anyone else on the panel has good advice on that.
Okay. Julia, from what I know a little bit more about you than what's been happening with the other three. So one thing that I know that you've dealt a lot with, for one, is manage the house that you're in. And you can go into more details about that. And can maybe you share, since the audience here, we're talking about high school students and teenagers, just the dynamics of that, what it's about in terms of when somebody was sick or somebody was not sick, and even the concept of misinformation.
Yeah, definitely. So as my dad mentioned, so that's my dad, if you guys didn't realize that. So as you mentioned, I was the house manager for my sorority. So I was kind of overseeing quarantine protocols, and during COVID last year, as well as this year, we all came back to Berkeley. Most of us still came back to campus to take online classes. And so I'm from New York, so all of us out-of-state students were still coming back and flying back to school and living here. And when COVID rates were still so high before the vaccine last fall, we had cases all the time. And so kind of regulating where people go, how to best separate people who are immunocompromised, who have additional health concerns if they did get COVID, as well as the kind of social aspect of feeling blame when you do get COVID was something we dealt a lot with as college students, I think. People didn't want to share that they were exposed or that they were feeling sick or had symptoms and needed to go into quarantine. And so kind of building that trust in our house was something that took a really long process in order for people to feel comfortable to actually come to me and ask for advice and kind of figure out what the next steps are. And so became a health worker for my university health services to be more trained and more informed on kind of what we're supposed to do. I think every house here, every dorm was doing something different. And so never really knew if you're doing what was right, if you're telling people the right thing, whether it's 10 days or 14 days, or once they're vaccinated, is it 5? Super confusing. And so kind of trying to regulate that and make it a normal process so people know what to expect. And taking away that idea that getting COVID is something you should feel ashamed for or not feel like you should be able to share with the people you're living with was something that kind of came up a lot. And we had to normalize that COVID happened for everyone. I had COVID, my dad had COVID, we all had COVID at some point mostly. And so just being open and honest and kind of learning from the process was my past 2 years.
That was great. So thank you all. I have sort of a follow-up, a sort of a general question that was asked by one of the individuals in the audience. We have this in writing, by the way. So with that in mind, what you just all said, how do you think that, or do you think that somehow coming out of this, that we have gotten something good out of this? So what has actually changed for the positive? What do you think we can take from what we've learned now for the last 2 years? And how can we change this into something positive? Or are you starting to see something positive coming out of this?
I can jump in.
Please.
I officially do telemed visits, which are really nice. Our electronic medical system now allows me to do video conference with patients that have questions, things that they want to discuss, more counseling points for appointments, because not everybody can just leave and come to an appointment, wait for hours to see a doctor. So that is a very positive change. I'm so excited that that's something that is being offered. So we're seeing a lot of trust in doctors, trust in coming to get checked out and everything else. Of course, there's no physical exam with it, right? But at least you're seeing a doctor talking about how you're feeling, which is important. And then number 2, personally, I feel that my patients are reaching out to family more, whether it's virtual or in other forms. I think people have realized with this pandemic that getting close to family and friends is really important, and staying in touch with everybody. So I think all these Zoom, virtual aspects, Meet, all of this stuff is a positive spin to all the bad things that we've gone through.
Feel free to jump in.
I think from a nursing aspect, it's definitely built a lot more respect for the healthcare team. In the past, I feel like nurses are always overlooked. Well, in a lot of cases they are. And it's also been an opportunity for like interdisciplinary support. So whether it's between like the respiratory techs and the nurses, there's been a lot more communication and understanding. And it's just nice to have a support system. And I think COVID did help foster that.
Who's going to go first? Stephanie?
Yeah, I can go. I think one of the things I've noticed a lot as a public health student mostly is you can't look at statistics for COVID and not recognize that there's a huge socioeconomic and racial disparity between COVID cases and COVID deaths and who's impacted by COVID. And I think the conversation is starting now about how socioeconomic status, social determinants of health impact everything. And it impacted COVID so much. And that conversation is now involved in every single class I have at Berkeley. Is every class we're considering, what is the racial aspects of this? Like, how can we really think about this from a lens? It's just a step back from just COVID exposure. Who's really these target populations we need to be thinking about? And so I think that's been really important as a country to kind of talk about and bring up in these settings and in the healthcare field. And when I was working at the hospital this summer, having doctors actually be recognizing that the patient that they're seeing was exposed because they still had to go to work and this patient doesn't feel safe getting a vaccine because they probably not trust the government or the healthcare system for years and years of their life. And so having that kind of humanity bring back a lot throughout the pandemic has been really interesting to see, and I hope it continues for years to come, and we can really start targeting those risk factors and the disparities that we see in the healthcare system.
Yeah, I'd have to agree with Julia for sure. I've been seeing more of those conversations pop up in the university, and we have a medical school here. So basically, most of our faculty are doctors. So I would say many more people are engaging in those type of conversations. A lot more like organizations, like student groups, are talking about it and educating faculty. And it's just really good to see that this definitely needs to be a thing that we talk about more often and should last past the COVID pandemic.
That was great. I'm in the same kind of theme. If I can just comment, I think that even in education, it became even more clear than ever the discrepancy that exists in educational opportunities because of COVID. Individuals that have access to their own bedroom, their own computer, their own sort of things, certainly were less affected by it than if you lived in a different setting where perhaps even the internet's not available and things like that. So the gap definitely widened by a lot more, and more than ever, it just showed the differences that exists socioeconomically. So I definitely agree with you guys 100% there. So it definitely has impacted us here too in school. I did turn around here to quite a few of the science research kids that, like I said, we don't have a class, but they are here to watch you guys, that they can feel free to come up and ask a question. Would anybody like to take that opportunity? Come on. You guys are taught to take risks. Ask them anything you want.
Yeah. Come sit right next to Pig and then they'll see you.
There you go.
Yeah.
Yes.
I guess I'm just curious about how you kind of chose.
Can you guys hear it okay? Yeah.
I was just curious about how you chose, I guess, what you wanted to go into and look into in college, whether it be like research or medicine, and if that changed at all during your time in college.
I can pop in.
I can start. Oh, yeah, go ahead.
I love science research. I love doing lab work. So actually after college, I was at a lab at Cornell Hospital in the city for a year. But then we used to have like weekly meetings at the lab talking about like, why didn't the labs match with what happened with the case? And slowly I just noticed that I was more of a people person and wanted to find out more about the case and have more of a people interaction. So that's something I learned about myself with having that experience. So then I applied to medical school and went on from there. And the reason I picked OB was completely, a surprise, but I was lucky. I joined a club my first year of medical school, and I got to follow this pregnant mom through her visits and her delivery. And I even went to the pediatricians afterwards and just totally loved that experience. And again, the reason I chose it is because it's a little bit of medicine and also surgery, which I love. So I kind of wanted a little bit of everything. So the best advice I have for you is put your leg in everything, get as much experience as possible, because you're never going to know what you like until you try it. And don't close your doors.
Anyone else?
I can go. So I actually had probably the biggest change ever in what I wanted to do. My dad knows I applied to college as a business student. All of the colleges I chose to apply to were based on having business schools, and I wanted to do international business. I thought that I loved science research. I loved doing research in high school, but I'm a talker. I love to talk with people and work in that way, and I was very persuasive. So I thought that business was where I should go. That makes sense for me. And then after graduating, I was like, I cannot not do science. I need to do something science related still. I still thought business was the right path. So I enrolled in a chemistry class for my freshman year, first semester, and it was awful. It was the worst class I've taken at Berkeley. It was so hard. I was like, oh my gosh, why do people do this to themselves? But I passed. So I was like, you know what? I can do this. I think I was always scared of doing anything technical. I always felt like, I don't need to do that. I don't want to be studying behind a book. I just want to like hang out. No. So I switched. I was like, okay, I'll do business and molecular environmental biology. I'll do the OChem and all the stuff. And then I called my parents one day. I was like, I think I want to go to medical school. They're like, what? Are you crazy? Like, you have never expressed interest in this ever in your life. I was like, I think deep down, I always knew being a doctor was what I was supposed to be. And I just was like, okay, full force medical school. This is what I'm going to do. And then ultimately I was like, I don't want to do business at all. I dropped that major and was like, public health is much more where I'm at, and doing social research and working in my community was more interesting to me and more what I was passionate about. And then in terms of medicine and doing women's health, I have a fellowship here that for the past this year and the next year, I'm in maternal child adolescent health that has given me the most opportunities I could imagine. And I've had such amazing conversations with professionals in public health, as well as OBGYNs and doctors, and just where their minds are at and their passions just align with mine. And so my advice would be literally just go to college and go with an open mind. And if you switch, you switch. I think I'm such a planner, and I told everybody I know exactly what I want to do, and I was literally lying. So just go in and have fun and take so many different classes, and then find what you like and go with it. And don't be afraid to switch, because it leads you down the right way if you feel like you're needing a change.
You guys got Jackie, and I have Steph.
So I'm kind of the opposite of Julia, because
Yeah.
I've always kind of known that I wanted to go into nursing. My mom is actually a nurse, so I had a lot of exposure to the medical field in general, and I'm super duper family oriented. So I did consider medicine at some point in time. And it's not that you can't be family oriented and be in medicine at the same time, but as a job, like being a doctor takes up a lot of your time. I'm sure you guys can attest to that. So I kind of like the flexibility of nursing and like being able to live both lifestyles at the same time, while also introducing with my love for medicine and interacting with people. And I always get asked the question of like what kind of nursing I want to do. So this is where I'm like, I have no idea. I still have a bunch of my clinical rotations to get through, and I just don't want to say like, oh, I'm absolutely going to do cardiology, because I did 6 months on a heart and vascular ICU, and I was like, you know what? Maybe cardiology isn't for me. I love it, but I don't think I could do this forever. So definitely keep an open mind. Let the opportunities come to you. Don't close any doors. And that's my biggest advice for you.
Yeah, I have more of a boring story, but it's kind of nostalgic because I was focusing and studying neuroinflammation and science research, and that's currently what I'm doing. So for the past 9 years, this has been my field, I guess, and I've just stuck with it. But I'd say, like, again, yeah, engage in every opportunity you can find, because that definitely got me to meet a lot of cool people and people I'm still working with. And probably will be working with in the future. And it brought me to a lot of different places like Germany. And I'm considering going to Germany for my postdoc. So yeah, be open.
Okay. Good. You good?
Thank you.
So by the way, Sarah is doing research at Columbia. And because of COVID, you know that the labs were closed to students during the summer. So she's been actually commuting to Columbia a couple of times a week. So she's super dedicated, comes back sometimes 9 o'clock, 10 o'clock at night. So, and unfortunately, Columbia has now limited the amount of time that a student can spend in the lab to only 3 months. So, so we're trying to adjust to that. And that's the reality of research programs like ours that we're trying to deal with. And our kids are so resilient. They're so amazing. You guys all know that. You guys want to live through it. That somehow we're still making it happen. So with that in mind, since Sarah, I'm going to open up again. I didn't see any volunteers, any takers. Yeah, oh, come on, Charlotte. So we do have Charlotte.
I want to
has
add
a question.
that. Sorry, Mr. Vergil. I want to add that, like, the kids
Yeah.
are definitely resilient, because I think applying to medical school and getting into medical school is way, way, way harder than it was when I was applying. So kudos to you guys. Even nursing school, any kind of school, it's so much tougher. You have to do so many things. So kudos to you guys for like trying to get everything done, but really just don't stress out. Try to really focus on what you're most passionate about. Spend time with your family, enjoy the process, because that's what's going to matter.
Okay, this is Charlotte. Yeah, Charlotte.
Hi. So for those of you who were like in school while COVID was happening, did you feel like doing that kind of like online, more virtual education, did that take anything away from your experience, like learning in the medical field? Because it's a very like person to person interactive thing.
100%. It definitely did. A lot of nursing is interacting with other people and like learning how to do your assessments and learning all these different skills. You have to be hands-on. So it was definitely challenging, but I will say our school did a good job of like trying to teach us online. So I remember last year, like at the peak of COVID, we still had classes and we were learning how to like insert a catheter, but you can't do that unless you have a mannequin. But they were like, okay, guys, like go grab a teddy bear and like set it up on your kitchen table. I was like, am I really doing this right now? But the principals were there. So they are trying their best. Fortunately, we have been able to go back in person, so we like solidified those skills a little more. So don't be scared when we come out of nursing school. We'll know how to do everything. Don't worry. But it definitely was challenging. And just like being on your computer screen, I'm sure you guys all know, being on your computer screen for the whole day is not, appealing, but we make it work. We're getting through it. And luckily we're transitioning back into going into person and going back into the hospitals for clinical rotations. So hopefully that continues to be the case.
I think I was really lucky that I got to come back. My parents were like, yeah, go to California, whatever. And so I got to still
Like that.
be
Just like that.
just like that. I still got to be with my friends and people taking the same classes as me. And I lived with 40 people still during the pandemic, which was pretty wild. But I think in terms of classes in school, just like Jackie said, in terms of getting clinical skills, we were doing labs and things with no data. So just like you guys in OHS are trying to collect data for your projects, we have to take labs for our majors and we can't do them. So we were looking at old data and trying to make these connections without actually having done any of the procedures. And I think in terms of learning skills related to research, it's really hard to email a researcher and be like, I took this class, oh, but I took it during a COVID year, and so I actually didn't do any of the procedures that I'm saying I know how to do. And I think in terms of
Stephanie, how
those
about from your perspective? Well, I think we froze.
Did I?
Did we freeze just now? Uh-oh. Now we're back. Can you guys hear me okay?
Yeah.
Stephanie, from your perspective, because these guys are undergrads, from your perspective, how has this interaction that Charlotte talked about of getting an education remotely, if at all, has affected you?
From a graduate student perspective, you mean, right?
Yeah.
Yeah. So I had some classes that were online as well, and they were more of my advanced classes. So I think so a lot of them were presentation based, and basically we'd have to do the Zoom thing. But also I think that there were some benefits to some classes being online. So I felt like when we did paper discussions, like I could participate better in a way, like online, as opposed to if I was in person. But that might just be a personal thing. Although I do think that in academia, it's still like a very social thing when you're giving a presentation and when you're asking questions. And I think there was a little bit of a disadvantage there, not having those sort of things in person. Now that they are in person, it's a very different, I feel like it's a very different situation. So I think having had that practice, if I had it in person during my courses, that would have been beneficial.
I'm just checking on the connection here. Can the entire panel hear us? Because we can't see you guys anymore except for Steph.
We can hear you.
Yes.
Yeah.
Yeah, I can hear you too.
So, yeah. So we have 11 minutes left. So if I can split this somewhat evenly, and I throw this out, you guys, imagine now that you have the entire high school for your audience as an audience. Can you talk a little bit about in terms of being a student here in Ossining, and if you had to give them an advice about, obviously you guys are all successful students or professionals, or you guys have had amazing careers after high school. What can you leave a lasting message for the audience, saying, look, here's a couple of things that I would keep in mind as I progress from high school to perhaps a career or perhaps college and eventually, beyond that. And I would say you guys have approximately 2.5 minutes each. Yes, I think, did I lose them? Did I lose you guys?
No, I'll start. Keep good relationships with your friends and your mentors. Those are your core friends, and it'll keep you grounded. A lot of times when you're confused about your career, when you speak to somebody who's a mentor that you think is a mentor or a really good friend from childhood, you say things out loud that you really mean. And when you listen to yourself say those things, that's when you realize your direction. So I think that's the best advice I can give.
Okay, thank you. Someone else?
I really encourage you to explore your passions. I was someone who did almost every club in the book. I was involved in so many different things, and I loved them. I loved all of them. But looking back now, if I had just selected like 2 or 3 clubs, I could have put more time into each of them. So don't spread yourself so thin. Like, find the things you love and stick to them. I'm not saying don't explore, but try to like focus on a couple things. You don't have to do a million things at once.
I think one of the trends I've seen throughout my career is something that I kind of learned in science research, which was just like cold emailing, essentially. So I've just used that throughout my career, where I just cold email like everyone. That's how I got a lot of the opportunities that I got, a lot of them being lasting opportunities. So I think if you just, cold email, you show up to things, that's really going to get you far.
I think my best advice would be to not limit yourself and to not allow yourself to feel like you're not worthy or qualified to do something. I think you go through science research, you have such amazing experiences. You guys are qualified. Like, you have experience in high school that most people don't have. It's not a normal thing to be doing what you're doing. So feel proud of that. And when you're talking to people, don't limit that. I think I wanted to go to USC and I got rejected. I worked my whole life, high school career to go to USC, and I didn't get in. And I was like, what the heck? What is the point of doing anything if you don't get what you want? I was so upset. And then I got into Berkeley. And if I hadn't gotten rejected from there, I would never have come here. And this is the best place on earth. I'm obsessed with Berkeley. And so those opportunities, one door closes, another one opens. It's really true. And so feel worthy of the opportunities that come to you. And if they aren't coming to you, go out and grab them, because you're experienced enough. You have the credentials, you have the passion, I'm sure, as well, to get what you want, to get those opportunities. So if you are feeling like you are not worthy of being somewhere, like you are the quietest voice in the room, feel empowered to take that space for yourself, make a name, and wherever you are, remember that you are just as good as everyone else, if not better. So always feel like that, especially during the college application process. It can be really hard. So
okay, so we still have a few more minutes. So I was going to throw this question to Dr. To Supriya, Dr. Mishra. Since you are a practicing physician right now, can you talk a little bit about what you feel or might be the weakest or perhaps the most uh, the most significant area in which people lack knowledge of vaccines and viral infections and things like that that you have to deal with, and that got particularly magnified during the pandemic.
I think the weakest spot would be sort of like where people get their knowledge from about these things, or questioning every little thing, like every vaccine that they've ever gotten, and what the products are in the vaccine, and how that can affect their baby, their uterus, their fertility, their periods, and all of that stuff. All legit questions. Just, I think the weakest thing again is the misinformation out there. So I think the misinformation that stemmed with the COVID vaccine has now affected people are not getting their HPV vaccine, which is a specific vaccine that prevents and like decreases chances of cervical cancer. So not just a disease, and that kind of ruined that aspect. So I think practicing OBGYN specifically, the misinformation with COVID kind of ruined it for all the other vaccines, unfortunately. But then on the opposite side, some people are like, yeah, just vaccinate me, give me whatever I need to do, and whatever my parents didn't let me have when I was younger, you know? So I just think that I wish as a doctor I had more time with my patients to undo some of that misinformation, because kind of like what Jacqueline was saying, it's a lot of talking and counseling than just, you need to get this, I'm the doctor, listen to me. You know what I mean? So.
All right. So imagine yourselves, and this goes to the general audience here, imagine yourselves being the superintendent of a school district. And now that we face this pandemic for the last, for 2 years, if you had to kind of infuse any change in terms of how we teach children about any aspect of health, what would you say needs to be done or needs to be improved upon? And that I'll leave that up to anybody that wants to tackle that on. Nobody wants to be a superintendent today, or maybe how about the head of the science department, or perhaps the person that is in charge of the health curriculum, or anything.
I think having more conversations, open forums about people's fears and where that's stemming from, and how can we understand people's fears and sort of answer their questions about their specific fears and sort of correct it. I think conversation leads to better medicine.
Mm-hmm. Yeah, this is.
I definitely agree with.
Yeah, Julie.
Okay, I was just gonna say definitely agree with Supriya about conversation, and I think in high school, in the younger ages and children, a lot of what we're learning is based on our parents, based on our families, and we're dependent on that relationship with your families to kind of get information. I wasn't watching the news when I was in high school. My parents would watch the news and then tell me what I needed to know. And so I wasn't in high school during the pandemic, but I can assume a lot of that's the same for students now. And so I think educating families, educating parents is super important. There's a lot of misinformation with language barriers and people who just don't have access to understanding what's going on in the news. And so for students, there's that barrier as well. So it goes down generationally. And I think in order to really help children and high schoolers be more ready to understand this material, if things like this happen in the future, it starts with families and parents. And so intervening at that level would be really good as well.
We have 1 more minute. Anyone else? Last thoughts? Otherwise, I'll ask either Mr. Jaffis or Mr. Yanko, if you guys are listening in, to come in and offer your gratitude if you guys can hear it. Otherwise, I'll do it.
Sorry, one more thing, piggybacking to what Julie and Stephanie touched on, not singling out the people that don't want the vaccine or have misinformation, but just trying to understand them better. So I think as a superintendent or the head of the science department, having these open conversations would sort of alleviate that. I think that is important.
Yeah, I think from our setting, right, where here's the bell. So I guess our time is up, and I can't thank you guys enough. From a personal point of view, and for speaking for Ms. Holmes, who's here. It is truly amazing the fact that you guys are all students of ours, and it's unfortunate that I'm the only one who looks like I'm aging. Everybody else looks exactly the same, and I really appreciate it, Mr. Jaffis, Mr. Yonkler, the school district. We owe you guys so much, and hopefully you guys can do this next year if you're available. And thank you all. And have a great day.
Thank you, guys.
Thank you, thank you, thank you. Bye, Spria.
Bye. Bye. Friday. Last 7 other girls.
Yeah, I'm out.
Oh, great. They're so sweet. I
Yeah,
miss
good.
them so much.
I know.
I want to chit chat with them. Oh.